I was 58 in September 2002 when my company closed down, but I had a pension and was still covered under my husband's United Healthcare plan. But in June 2007, when he turned 65 and went on Medicare, literally overnight at the age of 60, I had no health insurance. I can't buy reasonably priced health care coverage. $835 a month plus $10,000 deductible was the latest quote. And my pension makes me ineligible for state programs. I won't be eligible for Medicare until October of 2012. My husband worked for 40 plus years, 37 of them on the track division of Amtrak Railroad. The track division maintains and replaces the steel rails that the trains ride on. This is one of the most dangerous, backbreaking, and low-paying of jobs. So between us, we gave 80 plus years of service to this country, and now we run the risk of losing everything that we worked for and saved if I were to become seriously ill or injured. Over these past 3 years, we spent my 401k for medical, dental, medications, tests for my seizure disorder, and other health-related expenses. It was a lot of money, but this may sound odd, we still feel lucky. We didn't lose our house, and I'm still healthy. But I can lose sleep very easily if I let myself think about the what-ifs. So I became involved with healthcare reform a year ago last March for a selfish reason. I needed healthcare to be reformed. Over this past year, I learned about other people who are the ones I'm thinking about now. The woman whose family went bankrupt because Cigna had the absolute callousness to withhold coverage for medications for their 11-year-old twin daughters suffering with cancer. The woman who lost her job and her health insurance in the middle of chemotherapy treatments. The young man who couldn't get health coverage due to his diabetes, which is deemed a pre-existing condition. He couldn't afford the $3,000 down for an operation that would have reversed his blindness before it became permanent. The woman whose husband died and another whose little girl died. The family that put their young daughter's life in danger trying to avoid the insurance company's rule of pre-existing condition. And how they finally divorced so their child would qualify for Medicaid. If only these stories were unique. In fact, they are the norm. Over the decades, the healthcare industry has turned into a greedy, for-profit that holds human life as a commodity. I cannot for the life of me imagine why anyone would oppose this legislation that will help people by regulating the complete stranglehold the insurance industry has over the American people. But then I think about what these multimillionaires stand to lose, and there's my answer. There are the misguided. Even some friends of mine who have their good jobs and what they think is good health care coverage, who would find out differently if they were to become really ill, think these stories are fantastic and don't believe it because it is unbelievable. And then there are hateful people who love to scream and yell for the sake of screaming and yelling. And quite frankly, I don't think that any logical explanation would suit them. They really don't want to discuss. The ultimate, when they took what they consider righteous anger to throw dollar bills in the face of an old man at a healthcare rally who had to sit down due to exhaustion from his Parkinson's disease. The apparent latest last-ditch effort were perpetrating the notion that people without health care are nothing more than shiftless and lazy people who refuse to work. The picture frenzy is becoming dangerous, And if this legislation does not pass, these kind of people will have won. They will think they are right. The Democratic Party has given all the concessions it owes to the Republican Party. Republicans do not, never have, and never will do anything to correct the healthcare industry's greed. The Dems need to gather their collective backbone, forget about politics, and vote with their conscience. We thank the Congressman with all our hearts for doing just that. We hope that we have voted by now, and if we haven't, we need to do it immediately.
Okay, we have one more person to share her story. That's Tam. We're working on getting the Congressman on the line. He's going to address the crowd.